meeting, this is a formal council committee. The proceedings will take place live on the internet and the meeting will be recorded for future viewing. It will assist the conduct of the business if participants speak when invited. Members of the public are welcome to view the proceedings but should not make contributions at this meeting. All participants should mute their microphones and turn off their video feed when they are not speaking. Please remember to unmute your microphone and switch on your video feed when it's your turn to speak, and then speak clearly and slowly into the microphone. Anyone wishing to speak should indicate using the raise your hand button on the Microsoft Teams, and I will invite people to speak at the appropriate time. If you do not have the hand button, please type your request in the chat function, and I'm sure Helen will pick that up for us. I ask for everyone's patience with the use of technology, and I apologise in advance if we experience any unforeseen difficulties, which we shall try to resolve expediently. I shall now follow the items of business as set out on the agenda. The first thing I want to bring into the meeting is we're all aware that today is Holocaust Memorial Day. So I'm going to ask all members present, all the committee members and guests present, if we can observe a minute's silence to respect those lost in Holocaust atrocities, and also to the family and friends of all the 100,000 plus people who have been lost to this awful pandemic. So, Helen, if you can let us know when the minute's clear, please. Thank you, members. Thank you, everyone, and thanks. That's a most important minute that we've held. To continue, I'd just like to pass on our best wishes to Nick Barlow, who I believe is struggling with the dreaded virus. So we'd like to pass on our best wishes for a speedy recovery, and I hope he gets back to normal. Agenda item 1 is apologies for absence. Helen, do we have any apologies?
None received, Chair.
Thank you. No substitutes. So agenda item 3, to receive any declarations of interest under the Members' Code of Conduct.
Thank you, Chair. Steve Walter. I always declare this until I'm told otherwise, that I'm the nominated member, council member on the Council of Governors at Brussels Hall Hospital. Thank you. It's a non-decision making body, I hasten to add.
Thank you, Steve. Any more declarations? I've got a standing one.
Yeah.
Who's that?
Peter.
Peter.
Yeah.
Over to you.
I'm a member of the West Midlands Fire Authority, and they're mentioned a couple of times.
Okay, that's Councillor Peter Miller. Thank you, Peter. I have a declaration of interest, which is a standing one as well, and that's as Chair of Trustees of Dudley Mind. So any mention of mental health, that's recorded. Thank you, members. Agenda item 4, to confirm and sign the minutes of the meeting held on the 16th of November 2020 as a correct record. Can I sign those as a correct record?
Yes, Chair.
Yeah.
Yeah. I agree. Yes, sir.
Thank you very much. And a slight change to the running of the agenda now. Agenda item 9, because I believe Professor Paul Kingston has as somewhere else to go later. If we can move agenda item 9 to the next agenda item, please. So it's safeguarding.
Thank you, Chair. I don't intend to go through the entire report, but I have got 8 issues that I just want to alert you to. On page 5 of the report, we've more recently changed one of the main aims of our work next year from preventing violence across the life course to preventing harm. And this was a request by Kim Medill. I think this makes actual sense, really, because we are more concerned about the wider aspects of safeguarding, not just violence. You'll note on page 8 that year-on-year increases continue. We don't in any way accept that those are going to go down. They're going to continue to increase. There will in the future be resource implications, but you can see year on year those increases. Mostly we're finding that the highest factor is neglect, which is consistent with other authorities around the country. But again, on page 11, you will see that in most cases where we have actually intervened, risk has been removed, which is really positive. At the moment, we're having to deal with safeguarding and COVID, which everyone is aware of. And I've been incredibly impressed with the work in Dudley. The Safeguarding Partnership has met weekly since March of last year. I don't think many safeguarding partnerships around the country would have put that much energy into safeguarding that we actually meet every Thursday morning, 8:30 to 9:30. We have Kim Medill there from the police, we have Sally from the CCG, we have Matt, and we will have the new chair of the Director of Children's Services when she arrives in a few weeks' time. So I think that's been really positive. The issue that we've not put a huge amount of energy into this particular report because it's retrospective, but I do want to mention the work we've been doing with scams. Because of COVID, individuals have used this as an excuse to try and manipulate and fraudulently use the pandemic. And we've done quite a bit of work in terms of communication in that respect. As far as deprivation of liberty safeguards are concerned, again, very impressive work from Stephen Lonsdale. We probably have one of the lowest numbers in the country. We're running about 110 at the moment. Some authorities are running 4 or 5 times that, so we've done a pretty good job. And finally, I'd like to personally thank the police, the CCG, the local authority, and all our partners in Dudley who've welcomed me since I joined and who've been incredibly supportive and positive about the work we're doing around adult safeguarding. Thank you, Chair.
Thank you, Paul. Do any members wish to ask any questions? Councillor Cathy Baton.
Thanks for the report, Paul. It's obviously really comprehensive report, and a big well done to everybody who's been involved over the last 12 months of work under really, really difficult circumstances. I just wanted to pick up on a couple of points, and it was just really to ask or to find out a little bit more about the numbers around the increases in domestic abuse and the increases in I don't think suicides are a part of safeguarding, are they? But I do know that across the country we've seen a big rise in suicides, and I just wonder, in terms of the work that we're doing around mental health, around protection of in domestic violence, where that takes us to.
It's an excellent question, Councillor Baton. If I start with domestic violence, through our MASH system, we actually haven't seen a huge increase in domestic violence, but we have seen, the police are reporting a more substantive increase. We've actually done a deep dive on this, and we think what's happening is that the cases that the police are investigating are individuals that don't have any connections to the health and social care architecture. So we would be investigating cases through DV if they came through the MASH where we already had contact with those individuals, or perhaps even the children, if there were children in a family. So we are aware that the data isn't quite congruent, but we have done some work on that and it's on our radar. Regarding mental health, we've again, huge strain on the system in terms of the mental health. We're short of beds across the entire UK, and we have had pressure because some of the mental health practitioners have been actually working from home, so we've been getting delayed assessments. Again, at the last two partnership meetings, we asked for people from the mental health trust to come and explain what they were doing about that. So we've gained assurance that they have a master plan to try and sort that one out. But you're absolutely right. As we move out, hopefully, if we do start to move out and get some semblance of normality, mental health is going to be a huge issue for the future. And you're absolutely right to raise it.
Thank you, Paul. Any supplementary, Kathy, on that?
No, Dave, not from me. Thank you.
Thank you. Matt Bowser, next.
Thanks, Chair. Just to add a little to the 2 points. We have throughout the pandemic had a proactive communications campaign about domestic abuse to everybody who we know has either been a victim in the past or at risk of being a victim. There is a campaign that Safe and Sound have put in place that enable people, if they can't speak, if they're not at a point of safety, to dial a number, and I'll circulate those details to the committee today for awareness, so that the police can anonymously respond to make sure that everybody's safe. On the mental health side of things, we were looking at the numbers today in terms of suicides. Tragically, there has been a 100% increase in deaths at this point this year compared to the same time last year. And we know that COVID is a huge driving factor in terms of social isolation, vulnerability. And we are indeed experiencing an increasing number of people who've not previously been known to adult social care or the NHS, who are now experiencing significant mental health problems. There has been a proactive campaign on behalf of the Black Country Foundation Trust and by the council and in conjunction with our voluntary sector partners. But I think this is something that is going to be an increasing issue, both as we come out of the COVID pandemic itself and because of the socio-economic consequences afterwards. So it may well be a line of inquiry for this committee going forward. Thank you.
Thank you, Matt. Karen, do you want to come in there, Karen Wright?
Yeah, and good evening all. Yeah, I mean, just really to support what Matt had said, I think, and we're going to come on to the health and wellbeing strategy at some point, but I think it must be a focus for us moving forward, because the burden of COVID is going to hit the most vulnerable the greatest, and I fear that we will see that increase. So we need to look collectively to understanding what's happening and what we do moving forward. But I would have said many of the things that Matt said, so stole my thunder. Thank you.
Absolutely.
Thank you. Any more members? Any more comments? The one thing I'll just add is, as you would expect, as chair of the trustees of Dudley Mine, we operate throughout the 4 Black Country boroughs and part of Wyre Forest, and we've seen quite an increase in people seeking our support as a charity. These are people that might not be caught in the NHS network, but nevertheless, if we can do all we can to help support people, to stop them getting into the NHS network, we're doing as much as we can. All right. So thank you, Paul, for that report. That concludes the report, and there is one recommendation that we consider and comment upon the Dudley Safeguarding Adults Board annual report for 29/2020. Is that agreed?
Yes, Chair.
Yes, Chair.
Thank you, everyone.
Chair.
Thank you, Paul.
Yeah.
Thank you very much. Another change of plan, if I can, please. Can we move now to agenda item number 8? I received a request that this be moved up the agenda so that the NHS staff can get back to their work within the NHS, and we're happy to do that. So agenda item number 8 then the breast screening programme for Dudley, Wolverhampton and South West Staff.
Thank you.
Yours.
Thank you, Councillor. So I'm Karen Kelly and I've been to the Health Scrutiny Committee several times, and good evening. I hope you're all keeping well and safe in these terrible times. So thank you for inviting us this evening. We're going to talk you through our latest report in terms of the breast screening programme that we deliver at Dudley on behalf of Wolverhampton and South West staffs. So before, as you know, we had an incident that we're dealing with, hence why we're coming to give you updates following that incident from the Dudley group. So a recommendation is obviously we take this report and have any answers following the report, and then we'll take those forward. So a little bit of background. In line with current national guidance, the breast screening programme ceased in April 2020, and that was a direct request from the Department of Health due to the coronavirus pandemic. And as you can imagine, it's been a difficult time for anyone who was worried around that period. So what the team did is they had 5 tiers to go through in terms of managing the patients who are already on the list, patients who may DNA, and those who we needed to invite in. So currently we're on tier 5 as an organisation in terms of knowing who's been invited in for an invitation, knowing who's declined, and we're in the process of informing GPs, etc., of these ladies not coming through. So on page 2 of the report, you'll see the open invitations in terms of we've invited 6,802 ladies back because we recommenced the service on the 7th of September of last year. So we had quite a long time for a break, and then started working again on the 7th. And obviously now we've got a backlog to work through to make sure all these ladies are seen. So you can see in those tables there where we've had patients decline, ladies decline, sorry, or those that have come in and said they'll have a appointment. So within the report, you will see where we are operating the breast screening clinics and the capacity at each of those clinics currently that we are running. And obviously these are dependent on staffing and the coronavirus element in terms of people isolating and having to be at home. So all the risks associated with turning the service back on from September is recorded and monitored on the trust system. The serious incident that I referred to at the beginning, we have got an action plan. There are 9 recommendations that are still open, and some of those are intertwined with each other and interdependent on each other. 17 have been closed since the last meeting, but we are working through that action plan as we currently speak. Sadly, we've had to rearrange some of the dates in the action plan due to the coronavirus, and that's only normal in terms of where we are. So the paper intimates 2 meetings we've had with our exec team around the breast screening programme and what the actions are next. In terms of workforce, we are moving through. We have appointed a breast screening manager, which is really good. And some really good news around the mobile units. We have acquired 2 new mobile units, one for Wolverhampton and the other for Stafford. So again, the teams are working through those. And the difficulty is that there can only be a one-way system in and out because of the coronavirus and the risks that we're facing in terms of working. Another important point to note is there's a webinar planned on the 8th of March currently, and there will be a video dedicated to looking at breast awareness, so we can start raising awareness again, especially for ethnic and BAME minority groups. We're using all that we can to promote and share information, and most of the media comms obviously comes from the centre because we deliver the service for the NHS. I'm happy to take any questions on the report as it currently stands as an update. Councillor E.
Thank you, Karen.
Oh.
Councillor Elaine Taylor.
Oh, thank you.
Oh, hello, Karen.
Hello.
Reading through the report, I've got several questions that I'd like you just to, see if you can answer. Right, on the section 4, the open invitations, you talk about the backlog of women waiting and the numbers there. How long is this anticipated to take? How long will the backlog take for you to get through?
So if I have got the team on the line in terms of detail, but when you look at the clinics that we're providing currently, and based on those numbers, Pradeep or Ragvinder, have we got any time in terms of getting those numbers currently through that we've seen in terms of the 6,800?
So, yeah,
Sorry,
no, I was just going to say, I think it is a slightly chicken and egg situation at the moment, as described by Karen. Some of the constraint, capacity constraint due to social distancing has restricted capacity. And at the same time, the breast screening service supports the symptomatic cancer pathway, which is taken the priority as well. Just as an example, today, our breast screening director who was going to 10 couldn't because he's supporting extra clinic to support that cancer pathway. We're working incredibly hard to restore as much as capacity as possible. Just an example, one of the out of 2 vans that Karen outlined, one we've received yesterday that's being inspected, so that will give us some additional capacity. The second van is being delivered in March. And again, part of the plan, what we've asked NHSE is for us to continue to utilize the old van as well to get more capacity. So with all of this, again, we will regroup to look at what capacity is available and also the carve-out capacity required for symptomatic. And that would potentially give us an idea on the timeline. At the moment, I think the activity is slightly slow, so I couldn't give you an exact answer around how long it's going to take. Again, it would be just like a piece of string, how long it is, because the numbers are, again, we've got that backlog. At the same time, the capacity we're utilizing to clear the backlog is creating more backlog in the system. So we have to work through that, all of it. So we're working incredibly as hard as possible to restore the capacity. So I couldn't give you a definitive timeline on, I'm afraid, but we can work through that as and when all capacity is live and provide you a further update at some point.
Yes.
Yeah, so in essence, we can't tell you an exact time frame because we're still working through the quantums that we've got. But and COVID again, depending on what happens through this next peak. But we're working flat out with all the capacity we've currently got.
Thank you there, Karen. Karen, the table suggests there's a very low intake, a take-up of women in Dudley. What are you doing to address that? And what assurance can be offered from the Trust that women are safe to attend? Did the annual breast awareness work in November increase the attendance?
It can do, but people are frightened to come into a hospital when COVID's around. So normally it does. We have seen an increase in referrals more recently, but actually it's not due to any campaign. And the difference we have is we deliver the service. We don't do all of the campaigns that comes from the National Centre in terms of breast screening. But what we do is join any awareness campaigns to raise it locally and further afield.
Yeah, I take on board that hospitals are a potentially scary place for anybody to attend, you know. Is there any remote technology that can be utilised that could be located at GP surgeries maybe?
It's unfortunately it's a specialised van, and we try to do one-stop clinics for ladies so they don't have to keep coming back. So you wouldn't be able to put one of these vans located specifically for a GP service because it wouldn't be utilised to its full extent.
Oh, right, okay, I get that as well. I get that. Yeah. What about procedures, surgery? Have these still been going ahead, or is there a backlog on that as well?
So we haven't stopped any of our cancer surgery and treatments for any of our specialties. So if patients have got critical time management that's needed, that is going ahead. Now we may come across backlogs in terms of as we go through this peak. Some of our surgeons or others might need to have time away in terms of COVID, but right now we've got a full service running at full pelt is what we need.
Right, just one further point now. The original action plan, which was from 2018-19, there's
Yes.
not actions remain open. Is this an acceptable number, and what risks are posed because of this?
Yeah, so nothing's an acceptable number for us to remain open, but the interdependencies of some of those actions that we've kept open, because we want to make sure they're right. So an example of one of those is ensuring that every member of the breast team, wherever they're on the mobile or within the hospital, is absolutely understanding their roles and responsibilities and what's expected of them. So we didn't do that until we've got the breast screening management team in place, and Pradeep and Ragvinda, who's on the call, are part of that new structure that we've put in place at the Dudley Group. So that gives you an example of what's left open. So all of the actions are risk assessed, and obviously the services each time that the team meet as a directorate and service delivery group. So nothing's acceptable for me to be kept open, but right now we're keeping these patients safe and we're keeping the service running. We have been asked whether we can help any other boroughs in terms of breast screening, but right now we're just managing our own workload. But if we can, we will absolutely help other areas.
Right, okay then, thank you for that.
Thank you, Elaine. Councillor Jackie Cowell and then Councillor Alan Hopwood, please.
Thank you.
Thanks, Chair. Hello, Karen.
Hiya.
Just got some points really around the actual action plan.
Yeah.
And you've actually alluded to some of it. I mean, looking at sort of specifically at point 1, 3 and 5, to be honest, this thing around ensuring the breast imaging service meets all service specification, for instance. I mean, I must admit, I haven't been on this committee that long, so I perhaps don't have as much awareness of what this actual incident was that some of the others do. But to me, looking at that, I'm thinking, well, it seems quite shocking, because I would have thought that that was a given, if you see what I mean. It worries me that that's on an action plan and it's still ongoing.
Yeah, and some of that is what we're commissioned to deliver. And because we work alongside, we've got colleagues at the Royal Wolverhampton who deliver some of the service for us, but we don't manage that team. So it's quite fragmented in places. However, what we do is we meet on a regular basis, but some of the delivery is out of our control because we don't manage the staff. So this relates to, we want everything delivering that is in the service specification generally. And that means us working together on across both sides to deliver it.
Thank you. Any more, Jackie?
Right. Yeah, I mean, looking at again at action point 3, this thing around, and I think you did allude to that earlier to an extent, this thing around the team being aware of their roles. Again, I find it quite shocking that there's any suggestion that they don't. How do we get to that point?
So this lends itself to changes in the team and different roles and responsibilities and different staff being recruited because they have a different skill set. So this is about succession planning, growing the team and making sure everybody is aware of the boundaries and how they work together.
Right, okay. And just one final point on action point 5, where it says to ensure assurance of the breast screening process in line with this specification. It looks like that the deadline for that has actually passed. Has that been met?
And this is because we've had to delay the service due to COVID through April to September, and now we've turned the service back on. We want to run it fully in terms of the patients. So the team have set, I think you can see the new date in terms of, it was December, but we're still trying to work through the patients who are on the list across both services. But I don't know whether Pradeep or Ragvinda want to come in on that one, because I wasn't at the last minute meeting in terms of the
I
spec.
was just going to say, I think this paper was prepared in November, early December, to go through our internal governance. Since then, there's been some further progress. I'm happy to share some of the updated action plan with councillor members. Again, that particular action was related to RWT setting up some governance. So we've had a subsequent meeting with them to start agreeing, making some progress around that. So there's certainly been further progress in December and early part of January. So I'm happy to share updated action plan.
I think we could send, would that help if we sent that in so people can peruse that at their leisure?
Yeah. Yes, please, Karen.
Okay, we can do that, certainly.
Okay. Thank you both for that. Thank you.
You're very welcome.
Thank you, everybody. Karen Wright, can I bring you in now in case there's anything you wanted to fill in on that's been said so far? Karen Wright, did you have your hand up?
Sorry, apologies. I've just taken my hand down rather than coming off mute. Apologies. Yeah. What I just wanted to come in is around the issue of promoting the uptake of breastfeeding. Clearly, we are in difficult times, but there is some work I know that's done from Public Health, and I'm sure you've joined with colleagues on this call, promoting the Public Health England campaigns. But also, there's some work that's been done through the social prescriber link worker started in Netherton. Again, that's working with the primary care network to have that really grounded community approach in promoting the uptake of breast screening, and that's working with Cancer UK. And there's also been some work to train community cancer screening champions within general practice. So again, it's about that connecting with people, and all that will come together. And I think that we will see the uptake increase as obviously we start to come out of this period of COVID, where the people have got, understandable fears around taking that screening offer. Thank you.
Absolutely, that's really good to know.
Thank you, Karen. Can I just throw one in there? This is the chair. We've got a very well organised and I have to say efficient COVID champion scheme, which tells everybody out there who are COVID champions, and they feed everything into their social media networks. Is there a possibility we could utilise the COVID champions network to just reassure ladies who've been invited that it is a safe environment and they could attend a safe environment to get their breast screening done? It's just a thought, because it is part and parcel of the reactions to COVID.
Absolutely.
Karen?
Yeah, I would absolutely agree with that. And in terms of those roles, we're looking at a number of things that they can be doing as part of those kind of key people within the community. So I think that's a really good idea, Chair. Thank you.
Thank you. Councillor Alan Hopwood and then Councillor Kathy Baton.
Yeah, hello, Karen.
Hiya.
It's regarding item number 9, workforce. Can you remind me of the workforce issues you had? And also, is there a minimum requirement regarding workforce each day? And is there other requirements being met?
Yeah, I'll bring one of my team in to answer that. But in essence, we didn't have any. We didn't have enough workforce to deliver the service we wanted, because the demands on the breast screening team were quite immense in terms of what we expected them to do, and a backlog and extra clinics that we wanted them to work on. So we also needed a team to manage that, but with specific roles and responsibilities and skill set in terms of managing the lists and the patient lists and backlogs, etc., and the electronic system they use for booking. So we were not starting from scratch, but the team needed to be rebuilt in order to manage the service.
Thank you.
Thanks, Karen.
Thank you, Alan. And then Kathy Baton and then Jane Emery, please.
Thanks, Chair. If I can just take us back to the questions around backlog.
Yeah.
I'm a little bit concerned that you're not able to give a time scale, because I would have thought the capacity, You know the numbers of women who you've got in the backlog. So I accept some will not attend and there'll be some inevitable delays, but the surely is modelling around that can give us a rough timescale of how long the backlog will take. You know, I mean, I've heard some sort of stories around general backlogs of surgery, you know, non-essential surgery have been up to 3 years. Is that the kind of backlogs that we're looking at for breast screening?
Absolutely not.
No.
I think on the paper, just the point in tier 5 that everybody who was in our original backlog from the incident and further forward has been invited for an appointment. So we've got 6,800 invited for appointments. And we're not only just working through the breast screening, but we're working through the breast symptomatic patients as well. But just what you can see on the screen, on the paper, is the breast symptomatic. So we can work this up, but this is quite, we've only been running it again since September. And we've also had people who are shielding and the services go down in some areas. So that's why we're now remodelling what we've got. We know exactly where the vans are. The new van that arrived just today and the capacity of that. But all of this, again, the caveat is having the staff available to run all of these clinics. So we could say, we could give you a timeline that it might take 6 months, as well as trying to cope with all the demands that are coming through. But if one service or one area goes down, we're then to 7 or 8 months. But we can certainly, we will share that planning when we share the action plan. We'll give you some modelling in terms of what that looks like.
I think that would be really helpful, thank you. And I do appreciate, you know, your comments around if one part of the service goes down, it has that knock-on effect. And absolutely, I understand that. But I just think we need to have kind of, to understand that kind of ballpark arena of where we are now, because we're going to be coming back in presumably another 12 months' time, asking a similar question. So we'll want to have that updated information. Thank you.
Of course, no problem. Thank you.
Thank you, Jane Emery, coming now.
Hi, yes, thank you, Chair. I suppose, Karen, it was just a message out to say also within Health Watch, we've obviously got an information giving function. So anything that we can kind of get messages out. We've also got our information champion network. And obviously the Health Watch is part of Dudley Council for Voluntary Service. So if through the communities and the networks, we can promote some of those messages. Then there's an offer of support there really. So just to make sure that we're linked in.
Yeah, and I think it's so important that people gain confidence again in attending for treatments and especially screening programmes, because we won't be in COVID forever, but there is a general fear of coming into the trust or actually anywhere. But thank you, that's really good to know.
Well, thank you, everyone. Any more questions, queries for Kelly and for Karen and the team? No. Thank you very much, Karen.
Thank you, and thank you for inviting us. And we'll send the relevant documents through in the next few days, so you can send them out to all the councillors. Thank you.
Thank you very much. Okay, and there's that suggestion about utilising our existing champions network, because whatever we send out on the champions network, it appears on Facebook pages all over.
Brilliant. And we can use our team to work with the centre and use those avenues available to us. That's great. Thank you.
Yeah,
thank you, everybody.
I've sent that note to Liz anyway, so thanks very much. Thank you, everybody.
Thank you, everyone.
Thank you. The recommendation is that the committee notes the comments on the content of the report. Is that agreed?
Yeah.
Yeah. Chair, before we move on, can we just make sure that it's added to the tracker, the updates that are promised from the trust?
Yes, if you would. Helen, can you make sure of that then, please?
Yes, Chair.
Thank you very much. Moving on to agenda item 5 now. I'm sorry we're hopping about, but these are important people that have got more work to do after they've left us. Local and national COVID-19 developments, a verbal update. Who's this one, Matt? Karen? Yeah.
Yeah, good evening, sorry. Yeah, thank you. Okay, so in terms of the national situation, that we'll see that the rates across the country are starting to come down. Across the region, we're not seeing that reduction happening as fast as we are in the southeast and London. So there is an expectation that actually the region may become the area of the country that's got the highest rates, as the kind of our rates start to plateau slightly. So that is kind of a concern for us. But what we are doing, which is really important, is some really detailed work with our colleagues with Public Health England under the Directors of Public Health and at that local level to understand what is going on in the region and can we explain that. The general picture that we've got, and again, all the Directors of Public Health are doing really detailed work around this, is that we've got a high percentage of cases that have got the new variant, which is more infectious within our communities. And we do understand that we've got transmission from our workplaces, and that's going then back into households. And a consequence of that understanding has been that there's been ask that's gone from the regional leaders, and that's supported by the Directors of Public Health. 3 asks that we're sending up to the Secretary of State is one, for some clarity, some greater clarity around the definition of essential workers and essential businesses, because again the evidence is telling us that we've got that we've got more traffic on the road than we would be expected and we had in the first lockdown, which would suggest we've got more people moving into workplaces, and likewise generally, which isn't particularly the case so much locally, we've got more children in our schools, which then raises the issue around essential workers. The next point that we've raised, which did come up on the member briefing on Friday, was this point around the support that we're giving to those people who can't isolate because of financial challenges, and to get some understanding around what more we can do, both from working with workplaces, apologies for that noise in the background, and also working with individuals, in order that we can make sure that we're kind of taking away the barriers that do prevent people from being able to isolate. The final ask that we're putting in that we're sending up to the centre is just again to support that rollout of lateral flow. Apologies for that. Lateral flow testing, which we've got a good offer in Dudley, but again, so we can make sure that we strengthen the offer that within workplaces, locally and regionally. In terms of other work that's happening within Dudley, we are part of a piece of work with the Black Country, which is to get some greater understanding, behavioural insights we call it, so understanding again why people aren't accessing testing as well as we could do with them. So we've got increase in uptake of that testing to find the positives as early as we possibly can, which obviously is really important. The sooner we find people who are positive, then the sooner that we can actually do something to prevent that transmission. In terms of our rates within Dudley, we are starting to see we're seeing the reduction, which is what we'd want to be seeing, although that's not as quickly as some other areas of the region, in terms of the pace of that reduction, but it is all going in the right direction. The main the age group that's got the greatest proportion, the highest case rate is in our 0 to 15s, and that's particularly very young children, but again we think that's linked back to the household transmission, but again we do more work to understand that. We've had some detailed work that's taken place in Castle and Priory Ward, where we were concerned around the really high case rates of over 1,000 per 100,000, but that is coming down really well, which is good to see. And that was really intensive work that took place in terms of understanding the causes of transmission, doing promotion of the uptake of testing, working with local partners there to see, you know, is there any hesitancy around people going for testing, and what can we do? And that work was really well supported also by primary care and the police as well to do enforcement. So that has come down, which is good. We've now got we've got a growing number of cases in the Dudley Wood area. So again, not to the same extent as Castle and Priory. So we will be working with that area to get it to see what if there's any particular going on there. So yeah, Quarry Bank and Dudley Wood, sorry, that have increased, and Pedmore has also seen an increase. So the overall case rate that we've got for the last 7 days is 535 per 100,000, and we had gone right up to over towards 800 at one point. So that's good. That's coming down, but it is obviously still very high. And we've got a reduction in the case rate in our over 60s, which is we absolutely want to see, because that is where we see the significant pressure on our NHS system, and we are more likely to lose lives, which is clearly none of us want to see that. So that's come down to 395 per 100,000, which is a 7.3% increase. That's all going in the right direction. In terms of our testing offer, we've got the lateral flow testing that's taking place across the borough, and we've been actively promoting that, particularly for people who have to leave the home because they are essential workers, and for those also who have to leave the home maybe to support others and do essential journeys, but they've also got vulnerable people within their household. That's a 7-day-a-week offer that we've got in Saltwells, and that will be increasing to a 7-day-a-week offer also within Dudley Leisure Centre, as well as I think we've got 30 pharmacists that are supporting that scheme. And we are also this week doing a kind of train the trainer model, in order that some of our businesses in Dudley and on the industrial parks, as well as different areas of the council, can actually be supported to set up their own lateral flow testing within their departments. And just a reminder for members on the call, what lateral flow testing does, it picks up when people are infectious, and obviously the sooner we do that, then the sooner we can identify people and therefore stop transmission. And it has to be people who have no symptoms. So a final thing I'd like to draw your attention to is the work that we're doing around promoting people going for the PCR testing. That's the testing centres for people who do have symptoms. So there's increasing evidence, and again, because we've got such a high case rate across the country, that as well as the main 3 symptoms of a raised temperature, a new and continuous cough and a loss of taste and smell, that there's also more people are showing the diffuse set of symptoms, which are more like kind of flu-like symptoms or backache, feeling tired, and within children having kind of tummy ache, stomach ache. So we're asking people who've got any of those symptoms, rather than going for lateral flow, actually go for one of the PCR test in one of those testing centres, just as a precautionary measure, so that we're not missing out on anybody who may have COVID and not be aware that they're passing that on. In terms of our communications, there's an awful lot that's going on, and we're using behavioural insights to understanding how we get the messages across to different audiences and different members of our communities, and again through our community leaders and community champions. And it's really promoting the stay-at-home message. If you only go out for the absolute essential journeys, treat people and behave as though you are COVID positive. So 2 metres doesn't mean a metre and a little bit, it means at least 2 metres. Treat your face covering as though it will save your life, because actually it could. And obviously hand washing, and if you are in another room with somebody, to have that ventilation. So it's really reinforcing those key messages that we've been using all different mechanisms and really focused communications in areas where we have got that increased case rates. So lots going on. I think I've joined a fantastic team, and the partnership working is absolutely tremendous. And as well as obviously as part of this, we're looking at the resilience in our system around the demand on in terms of our funerals and mortuary capacity, etc. So we are, we are in a good place. I think Matt may talk about the hospital demand, but we are seeing there has been obviously significant demand and pressure on our NHS system, although that's starting to plateau a little bit, and we have seen significant outbreaks across the borough, both in care homes and some workplaces. But we're working with our partners and with those settings to understand what measures need to be taken and making sure that we've got the support in place. Finally, enforcement. Sorry, I'm going on. In terms of enforcement, there's some really good work that's going on with the police, where we've been visiting those premises that are open, the retailers that are open, and reinforcing what COVID measures are, and where necessarily been working with the police in terms of using our enforcement measures. So those are some of the key points that I'd like to bring to your attention. Thank you.
Thank you, Karen. I've got three councillors in the order the hands appeared: Kathy Baton, Jackie Cowell and Elaine Taylor.
Thanks, Chair, and welcome, Karen, to your first scrutiny meeting, first of many. So I just want to take you back to the start of your presentation when you talked about what is essential work and the fact that we seem to have far more cars on the road at the moment than there was certainly in the first lockdown. And also the issues around people either not going for testing or feeling that they are not in a financial position to self-isolate. And really, you know, that kind of representation to government is critical. I've seen a letter which went out from BAYS supporting all construction work to continue, not just the big external infrastructure projects, but construction work in people's homes are. And whilst I accept that many construction workers will be self-employed, nevertheless, is it critical and important and essential to get a new kitchen fitted right now, or to get your double glazed windows redone? And I understand all those are given an exemption, a business exemption, as being business critical. So I think in terms of representation to government, that really needs to be made. And just to talk a little bit more about the increase in the problem around getting people tested. If people are in insecure employment or on 0 hours contracts or are in financial difficulty, they're not going to get tested because they can't afford to. So we have to absolutely fix that issue. And just one question for you. Obviously, for the general public, the rule is 2 metres distance. Now, I think going back sometime last year, the government guidance in schools was reduced to 1 metre distance. Is that still the case?
Yeah, picking on a few of those points. So in schools, we've got far fewer children, obviously, in schools at the moment than we've had before, and there isn't a change, to my knowledge, in the distancing within the school environment. We have got, I have to say, our schools are in good position at the moment with the testing that's been rolled out, but also we've got very few cases within our schools. It's more within nursery environments that we do have issues. And Chair, if I may, picking up on your issues around that understanding actually where we have got transmission, and your point about construction, those the kind of things that we are looking at in detail with all the directors of public health to say what's our evidence that these things are being a source of transmission, and therefore making sure we're very clear in terms of our understanding, and our message is up around around what does need to change in terms of any future measures. So those are kind of things that we are picking up and feeding that back up to central government.
Thank you, Karen. Thank you, Kathy.
Thanks.
Councillor Jackie Cowell, please.
Thanks, Chair. I have raised this before. In fact, I think I did raise it on Friday night in the members' discussion. But I think it's something I want to pick up on again, because it follows on actually from what Councillor Baton has just said in relation to the construction issues. There are some national guidelines which actually discuss how construction and work should carry on in people's homes. But their opening gambit, and this is a government publication, says that work shouldn't take place where people are shielding unless it's necessary. But then there's kind of a gap because it doesn't go on to say what measures should be in place when that has to take place. And we know that certainly the council are still doing some repairs. Other private residents across the borough will no doubt be having repairs, etc. done. And I think for me that is a big issue, and for a number of other people, what we find is people are frightened when they come because they're not wearing PPE and things like that. Now the guidelines actually say they don't have to, but that seems like a real fundamental flaw when we're told that if we go out we should, not go near anybody, we should be masked up and all the rest of it. And I do think it's something that we could do with having a look at, because there's got to be a clear potential for spread there if people are coming in and out of people's homes and doing that work and putting down dust sheets, for instance, and then taking them elsewhere. Is there any way we can feed that into the sort of things that you were discussing earlier around those conversations with other directors and the government?
Yeah, Chair, I can certainly do that. So I think in terms of somebody's going into somebody's household, actually they should be wearing, they should be wearing face coverings. What we are doing through Dolores is, who's part of my team, and with the trading standards and environmental health, is they're doing lots of work around actually responding when people have got concerns and promoting what COVID secure business measures are. So, and in terms of our own workforce going to do essential repairs, they would certainly be following really stringent infection protection and control measures, and training, etc., has been put in for that. So, but I'm very happy to take away and have a look to make sure that we're doing everything that we should be. And secondly, I'm very happy to take away the points that you raise about making sure what practice is going on and feeding that up again. Are we seeing cases that are linked to people going into people's homes? I know in my last area of work, one of my other areas that we did see that, and I have to say I'm not sure whether we've seen that in Dudley, but I will follow that up through. So thank you for raising it.
Well, can I just say briefly that the problem is that the guidelines specifically do say at the moment you don't have to wear, the national guidelines that is, that you don't wear face coverings, and so we are having problems with contractors and staff. Not so much necessarily at Dudley's own staff, but certainly a lot of the contractors are not. They're refusing in some cases to wear PPE.
Right, I will put that up, because if you're going into somebody's house, and if that's a loophole in the guidance, absolutely that does need to be addressed. So, of course, I will pick that up. Thank you.
Thank you.
Elaine, you're next.
Right. Thank you, Chair. Hello, Kevin. Councillor Baton already covered some of what I want to raise now. Why are people not taking up the testing? How much of this do you think is attributed because of the financial restraints? Do we have any data on the people that are taking it up, what age groups they are, and is there a specific, can you identify the specific area that aren't taking it up? Is there an age group that aren't taking it up, or is it across the board?
Yeah, thank you. And again, a really good question. So what we've actually got a map that does show us both where we've got outbreaks. We've got increased cases, and the case rate for the last 7 days is higher in particular communities and particular age groups, and we've got that mapped against the age profile of people who are taking up the testing offer. So our concern really is, and generally compared to other areas, we are pretty good in Dudley in terms of people taking accessing the testing offer. Our concern is that we are certainly that there will be hesitancy to take up testing if people know that then actually if they're found to be positive, that puts them under financial constraint. Yes. and that will apply equally in Dudley as it will in other areas. So that's where we want to get a more understanding to what extent that is actually happening. in terms of have we got some evidence of that being a challenge and for people isolating? Again, I think all across all of the public health teams and the contact tracing teams, that is a common theme that comes up with people saying that actually, you know, the difficulty in being able to isolate because of the pressures that puts people under. I think important measures that we are taking though, and I think they're doing this well, is to make sure people are aware actually what support is in there, that communities are providing that support and obviously access to the welfare the welfare benefits that are in place. But we do need to do more work, and it may be, and I don't know this now, I don't have evidence of this in Dudley yet, but other areas do, that where you've got workplaces who could be reluctant to encourage their staff to go and get tested because they are really concerned about the impact of their business. And I think I mentioned on Friday my kind of experience of being on the farm that had the huge outbreak, of really being there and understanding the absolute pressures of somebody's trying to hold a business together, and also to support their staff, who most business owners really value their staff, but likewise being concerned about keeping businesses going, and it is really challenging. And it is a pandemic, and I think we have a lot of measures in place. So I think we have to be clear about, is it that people aren't maximising everything that is there to support them, and that might be an issue? Are there fears that actually are unfounded fears? And then there may be, and also are there other things that we're not doing at the moment that we need to be doing? So I think there's three of those questions that we need to be answering, and that's why I was really keen that we get involved in this work around behavioural insights, so understanding in really detail what can we do differently that will help everybody to play their part. And if I could just get a final message over there, that the vast majority of people, and that includes people in Dudley, are absolutely doing the right thing. There may be lapses, and I could imagine, my mum walking in Himley, and she's with her walking group, which she's not doing now, but just getting a little bit closer so she can hear somebody, because she doesn't put a hearing aid in. So there can be lapses that any of us can make, and because the new strain of the virus is actually is a lot more infectious, it's much harder to prevent that spread. So it will get spread, but the more we can do to follow the rules, obviously, and help people to do that, the better that we can all play our part in preventing it. Thank you.
Chair, can I just ask a further question there? Karen, do you think it's the financial assistance that is on offer, do you think that it's sufficient and easily accessed for the people that actually need it? Because if the type of work that you do, if you're not in a particular category, you can't access it anyway. So, is there a gap there that we can look at filling?
Well, I think so. We do have the use of the discretionary grants to help businesses, and that has been used in the council. In terms of some of that more detailed understanding, I think we still need to do some more work to say, what is it? Is it, and clearly there is significant hardship across the country as a result of COVID, without any doubt. There's no doubt about that. But I think it's what does better look like, and I don't honestly think we've got the answer to that, and it will be different for different people, which is why, again, doing a bit more work to understand with individuals, what are those issues and what can we do differently? I think that's why we need to do that, and it's incredibly difficult. This is unprecedented, the pandemic that we're in at the moment, isn't it? So
it is, but if it's a balance between putting food on the table, going to work to provide for that, or and just having very mild symptoms to go alongside it, where do you balance that? Where does that person balance it? How do we, make them understand that,
and with all of these things, and likewise, I think around the issue of vaccine hesitancy, where people are not sure about taking up the vaccine, I think our first point really has to be to have that understanding. And I think you make a really valid point there. Actually, what we as individuals do, it's really tough, isn't it, when you've got those challenges? So so I think there probably are some other things that need to be done, but really being clear about what is the best thing to do. And I think having that understanding is really important, but there's no doubt about there is huge hardship and very difficult decisions for people to be having to make. Thank you.
Thank you, Karen.
Okay. Thank you both. Does anyone else want to come in on the update? Speak now or forever hold your peace, as I say. No, thank you very much for that, Karen. Moving on to agenda item 6 now. Then this isn't an officer report. It's just our action tracker, which we've had as a result of the COVID scrutiny. I'll run through pages starting at 1. If anyone wants to specifically ask a question on the action tracker, can you just indicate by putting your hand up? And if there's any officers relevant to that tracker and that action, could you come in with the answer, please? So page 1, anything? Councillor Elaine Taylor?
Sorry, Chair, it's not page 1. I'll take my hand down till you come to that page.
Okay, page 1. No. Page 2. Nothing. Page 3. Nothing. Page 4. Yes, Elaine Taylor.
Is page 4 item 93? Or is that page 5?
It don't matter, Elaine. Just...
Oh, right, okay then. It's on page 5 anyway. Item 93. It's part of the homeless issue, the accommodation during the winter months. Can we have some data on how many people we're talking within this report? And are they homeless or roofless? Because there is a difference. So, you know, can we have some more detail on that, please?
Okay, Elaine, thank you. Cathy Baton.
Thanks, Chair. Page number 4, and it's item 107. If we could have an update, please, from Matt Boucher on that item.
Okay. Councillor Alan Hopwood.
Thank you, Chair. It's just want to know about on page 5, item number 93. I just want to know the ratio of these that have helped and those who refused. Thank you, Chair.
Thank you, Alan. I'm sure we can get the questions to the relevant officers. Matt, did you want to come in on 107 on page 4?
Sure. Councillor Baton, can you do me a favour and just remind me what the question is, because I've got my papers all over the shop at the minute, sorry.
Yeah, no problem. So 107 says that the Director of Adult Social Care update the Health and Social Committee on developments regarding the directive to identify care homes to take COVID-19 positive residents across the winter months to alleviate pressures on the NHS and associated impacts.
Yes, of course, and thank you very much for that clarity, because there's no way I'd have guessed the right question if I carried on without it. The technical term for a care home that accepts COVID positive patients from hospital is a designated setting. A designated setting is registered by the Care Quality Commission to provide that service. In Dudley, we have one designated setting, and that's at Russell Court. They are currently accepting patients who have a COVID positive diagnosis. And we've got a number of beds that are block booked there that Dudley CCG and the council are commissioning. There is a detailed hospital discharge procedure in place for people coming out to make sure that their COVID status is clear. As it stands, there are 24 care homes in the borough that have an active outbreak of COVID-19 in them. That data is going to be updated tonight in around about 50 minutes time. At the moment, the transmission point is from staff in to residents. What we have to keep an eye on and make sure we don't see happen is COVID positive people being discharged knowingly into those homes, because we cannot go back to where we were during the first lockdown, where we had, I think, 69 people tragically died in residential and nursing homes once COVID got in. So we're working hard to keep it out. We've got a very close eye on the data, and we're also looking at the root source of where COVID transmissions are taking place. Wherever there's an outbreak, an incident management team meeting takes place. We do a risk assessment. We look at what we need to do to stop the spread further. So back to the original question, one designated setting in Russell Court, and that's where COVID positive patients have been discharged to date.
Can I just follow that up with a supplementary? Yeah. Is that one facility adequate in the current climate?
The Dudley group would very much like to see a second designated setting in the borough, and I've got no doubt that if we had one available, that it would be very quickly filled. The difficulty is finding a home that could be registered by the CQC to that effect, and finding a home where the physical environment is such that the risk of transmission to pre-existing residents is minimal or non-existent. And if I can, just to add a slightly different perspective to this, a residential and a nursing home is a person's home. It's where they live. They've got tenure there. There might not be a tenant, but it's their space. How would you feel, or anybody else on this committee feel, if somebody was moved into your home who was exhibiting all the symptoms of COVID-19, knowing that you are more likely than not well into your 80s and upwards, knowing that you're vulnerable, and knowing that you'll have staff looking after you who are in and out of providing care to other people? So, you know, a lot of families have suffered for a very long time with not being able to visit loved ones. A lot of residents in care homes have made huge sacrifices in order to stay safe, and the staff that have been in there supporting those people have been nothing other than, frankly, heroic. We do need another designated setting, but what I will not sanction as the DAS is a designated setting that knowingly puts other people at risk in their own homes. It's not right, and it's not justifiable.
No, and I would absolutely support that position. I suppose the follow-up question to it is, how do we get to the point, how do we get to a position where we can offer that second designated establishment in a way that is safe and fair for everybody?
Yeah, and the answer to that lies in the discussions that our commissioning teams are having with all the homes. So you will know from previous updates here that we've got different occupancy levels in different homes. When we get to a point that we've got a home that's suitable, that's got an entire floor that is accessible, we will go into those negotiations. We're also looking at other settings like former care home sites and whether they could be potentially remobilised, where the council still owns them. There's been some debate nationally about whether a hotel could be an appropriate setting. If we get to a dire point, and I say this in the context that delayed transfers of care at the moment have been kept low for a long time, and hopefully it will stay that way, then we will have to look at one of those alternative options. But you can see the logic and the sense in using a completely different environment to moving the risk into somewhere where there's already people who are highly at risk and susceptible. The other hope on the horizon is, of course, that now every one of the 1,700 people in the borough have been offered the vaccine, and the vast majority have had the vaccine in a residential or a nursing home. We need 3 weeks to pass now to get up to the 80% resilience. We need the second jabs to happen to give assurance that that protection is there. So there is an end in sight here, and it's now a really careful balance in terms of time in making sure that the NHS system flows and people who need the beds get them, but we don't do that much like we had in the first lockdown to the detriment of the community and to the care homes, because I do not want to see people die unnecessarily in care homes, and I'm sure nobody does.
No, absolutely. I think we would support that. You know, we were all absolutely horrified at the first wave, where positive patients were being discharged across the country into care homes. So if you can just keep us up to date on that, Matt, that'll be really helpful.
I will do. It's also a weekly discussion at the Safeguarding Executive. So we're going to stay right on top of this to make sure we've got a clear picture. And as I said, the latest cut of tonight's data will help see the position. I think it'll rise. I'm hoping that the peak is nearly there in terms of the NHS. And then hopefully with infection rates dropping and the vaccination rates going up, then we'll get to a much safer place with all of this. But it's a real balancing act in the meantime.
Thank you.
Thank you both. Councillor Alan Hopwood, is that a legacy hand or is it a new one?
Sorry, Chair, it's been left up. Apologise for that.
Okay, thank you. Karen Wright, Karen, do you want to come back in again?
Yeah, if I may, please, Chair, I just want to pick up on the point around vaccination, which I would have talked about, and I think obviously the rollout is absolutely fantastic, and that's clearly what we need to be seeing and supporting. But I just want to kind of get this message across that because it's a new vaccine, obviously it's going to produce antibodies, and it's going to provide some protection in terms of people both becoming infected themselves and becoming symptomatic, or actually being a vector for transmitting the virus onto somebody else. So it will be important that we continue to maintain the vigilance and behave as though we have COVID until we've got, a significant proportion of the population who are vaccinated, and I think around the point of care homes as well. So, we can't have any relaxation of the measures that are in place to protect people until we have got that second vaccine, and we're still going to have to be really cautious around the whole issue of visiting policies, etc., and protecting those populations. Thank you.
Thank you, Karen. Right. Carrying on, are there any more queries, questions about the action tracker? Page 6. Councillor Steve Waltho, is it?
Thank you, Chair. Yeah, I think I've jumped here. I've jumped.
It doesn't matter, Steve.
I've jumped onto page 7. Is that all right?
Yes, fine.
And as it happens, on kind of both items here. Firstly, from a very personal point of view, para 125. My dear wife took a course in signing to support a deaf relative, and also very proudly I'm patron of Access in Dudley. And certainly in lockdown, we recognise people with disabilities are almost doubly isolated, or can be. They're shut away and without any means of kind of communication. So I was quite interested in this issue, and really just asking Matt. I presume Queen's Cross must be closed again. It was during the last lockdown. So have we made any progress on this signed video service for deaf people?
Yeah, Queen's Cross is closed at the moment in terms of the public, but it's been converted into the Pleased to Meet You services operating base, which has been proactively contacting people from right the way across adult social care throughout the pandemic. The visual impairment team have done some work on comms. That was following a very helpful session that Healthwatch Dudley pulled together for us, when a range of different people came forward and told us about their experiences during lockdown. So we had representation there from the deaf community. We also had a number of people caring for people with dementia talking about their experiences. And what is very, very clear from that is that the way we're communicating right now does not work for a significant chunk of people with social care needs. And it also doesn't work for carers who are feeling isolated. So there will be some positive news very shortly in terms of the new Carers Hub. There's going to be a launch, and I'll ask Marie to touch on that when she gets the telecare update. We have done a lot of work on communication in the intervening months, and I'll share some of the details with you outside of the committee if that's acceptable, Councillor Wolfe.
Okay,
all right.
Matt.
Can I just come in on 125? Should that date be 2021? January 2020? Or possibly should be 2021 when it's going to be implemented.
Highly likely, Chair.
Carry
That's
on.
probably me. Sorry, Chair.
Oh, caught her out. One date mistake in thousands and thousands of pages.
Chair, I haven't got spotted there. Well done.
Yeah.
Can I move on to the second issue on that same
Please.
page, yeah, because I think I actually raised this during the committee, and my genuine concerns about certainly the sustainability of the voluntary sector at these very, very difficult times. Also, being a bit of a volunteer myself, I have been, and seen the enormous pressure that the voluntary sector are under at this time. I see at the end the actions, and I just wanted to ask, have the options that are discussed there been explored at all yet? Have we had a chance to do that? And for the financial support of the voluntary sector, and also how much was the ring fence money, and just roughly, do we know where that's been allocated to, the COVID monies?
Yes, we do. It would probably be worth covering this specific point when we get to the medium-term financial strategy, because it sets out the detail in terms of next year's investment plans. Just to answer the latter point of your question now, there have been so far 3 tranches of different monies that have come in from government to the council. The first was called the Additional Care Payments Fund. That was the first pot that arrived in spring, that was all parachuted out to care providers to help them with some of the pressures they were facing. We've subsequently had 2 rounds of something called the Infection Control Fund. They were monies specifically designed to help organisations out with PPE, with adaptations that needed to be made to physical environments, with additional staffing costs, etc. And those 2 funds have been rolled out now successfully. And we've just heard, and I'll provide more details in due course, that there is a new tranche of cash that's being rolled out again to help organisations with caring responsibilities through the winter period. We haven't got the full criteria through, but some of that will hopefully touch on some of the voluntary sector organisations in the borough as well. So it's been, in simple terms, cash in, cash out. As we've had the money come from government, we've taken a line as a council, whether it's about supporting businesses or whether it's about supporting the care sector specifically, that we get those funds to work as quickly as possible. We make the process of claiming those monies as light touch as we can, whilst having a proper audit trail, and put the money to work. So that's where we're at the moment.
Okay, that's helpful. But just to follow up, if I may, just on that, Chair, because the original recommendation was to look in more depth at the long-term financial sustainability and support for the voluntary sector. Now, I guess during the COVID crisis, that move has not been made yet.
Yeah, I think it's impossible to accurately model the long-term financial sustainability of anything right now, Councillor Wolfo. The job that we've worked on this year, and I would pay credit to my colleagues in accountancy who've had a devil of a job working out where the budget position is, let alone forecasting the next one, has been very much about keeping the system afloat, keeping services operational, keeping staff paid, and keeping the lights on where there's a physical base for buildings. As we'll come on to in the medium-term financial strategy, we've tried as hard as we can within the confined financial constraints the council's got to protect the care marketplace going forwards. And we have taken a step to rethink the voluntary sector tender that was due to take place and has now been shelved. That will directly benefit some local organisations, but unfortunately I can't get into the detail into scrutiny because it's subject to procurement. So we don't have a long-term financial sustainability strategy for the voluntary sector or the wider care marketplace at the moment. Clearly what we will need to do, particularly given the exceptional support the voluntary sector and the care sectors offered throughout the pandemic, is work alongside those organisations and do the best we can in the context we find ourselves in. But I can't give you a fully costed, fully modelled sustainability strategy for the voluntary sector at this juncture, any more than I can anything else, I'm afraid.
Accepted. Yeah. Cheers, Matt.
Okay.
Thank you, thanks.
Okay, Steve. Thank you. Karen, did you want to come in?
To be fair, I think Matt's covered the points that I wanted to around that funding. So no, that's fine. Thank you, Sarah Chapman.
Okay. Thank you. Moving on, pages 8 and 9, 10 and 11. Councillor Cathy Baton.
Sorry, I wasn't quite quick enough, Chair. On pages 8 and going on to 9, it's just a concern around the fact that all of the children's actions are progress to be reported, and we haven't had reports on those. So if that can just be noted, please.
Yes.
And also point 160 from Paul Mountford, Head of Planning and Regen. I'll allude to that if you don't mind, Chair, and pick up a little bit of that in terms of the health and wellbeing strategy, because I'm concerned that our strategy in terms of employment and skills is not really where it needs to be given our claimant increase. But I'll pick that up under the strategy as a whole.
Okay, thank you, Cathy. Pages 10 and 11, 12 and 13, 14 and 15. Councillor Lane Taylor. Cathy Baton.
Sorry.
Go on, Elaine.
I was talking to myself. I didn't realise I hadn't put the sound on it. Item 168. Can we just see where we are on the food parcels? And can I ask a question? If all schools have been reimbursed for COVID expenditure up to date, and are we still doing food parcels, or are we going back to vouchers to cover the children that who meet this criteria for free school meals?
Thank you, Elaine. Matt, do you want to come back on that?
Yeah, I can give a partial answer to that one. I'll need to refer the question about schools and the meals to Helen Ellis to respond to, and I'll ask Helen to come back directly tomorrow. In terms of the broader setup at the moment around food parcels, government wrote out, the Ministry for Housing, Communities and Local Government wrote to everybody on the shielding list in January. We've got a service that has proactively contacted all of those people, firstly to make sure they're safe, secondly to make sure that they have an ability to access food, and where they don't, the parcels have continued. And the third thing that's probably worth noting is there's a number of local almost mini food banks that have popped up as well that are serving local communities. I know Councillor Ali's been involved in one in his ward, and there's numerous examples of that across the borough. So the quick answer to the question about the food parcels is, where somebody is shielding or clinically extremely vulnerable as defined by government, then we would have made contact and put a service in if required during this lockdown. And I'll come back to you on the issue about the schools questions that you've raised, Councillor Taylor.
Thank you.
Thank you. Cathy Baton.
Thanks, Chair. 184, which is just an update on where we're at with the ambulance service. My understanding at the moment is that ambulances are queuing for significantly long periods of time with very poorly patients on board. So if Neil's still on the call, can Neil just confirm the current position with the hospital trust, please?
Neil, over to you.
Yes, I can. Yes, Chairman, forgive me if there's some background noise. I'm at the Black Country Museum at the moment. Ambulances being delayed outside ED is still a significant problem. It's been a problem since Christmas. It's all part of the extensive pressure that's in the system at the moment. Just to give you a couple of illustrations, we had cases locally where ambulance paramedics were coming on shift and spending their entire shift with one patient outside ED waiting to be offloaded. I've been on call this week. Yesterday evening, I had to coordinate a conference call at 11:15 last night with all 4 acute hospitals in the Black Country because they're all under the same level of pressure. It's not just a Dudley problem. It's a Black Country system problem. It's a problem that's been experienced up and down the country. So there's a specific piece of work taking place at the moment that's being coordinated by Richard Beacon, the Chief Executive of Walsall Healthcare, who's the Black Country Urgent and Emergency Care lead, just to look at this issue, try and get behind the numbers a little bit more and get a clear understanding of what's actually happening. All I can say from a kind of Dudley perspective is the difficulty that we've experienced there is that despite all the work that Matt's team has done and my team in the CCG has done to get patients discharged over the past few weeks, where our performance has been a lot better than it has been historically, there are still problems within the hospital in terms of the capacity that they've got to isolate COVID positive patients, and they're juggling beds on a daily basis, on an hourly basis. So it's a huge challenge at the moment. I think it's something that we're still looking at. I haven't got all the answers right now, but we are trying to deal with that at the moment, and we're doing it on a Black Country basis.
Thank you, Neil. Kathy, do you want to come back?
No, that's fine. Thanks, Neil.
Thank you. I do recall, Neil, we have a colleague who's in the ambulance service, and he just completed a 14-hour shift, and he was still sat outside A, E and ED department, number 7 in the queue. That's after a 14-hour shift. So there's no quick fix to this, I'm afraid. But I know everybody's doing everything they can. Thank you very much. So that completes the action tracker. Thank you very much, everyone. And I have to say, I was really impressed with the action tracker when I first saw it. And I'm even more impressed that we're asking questions about the action tracker. So thanks, Helen, for devising that. And thanks, Steve, for not claiming the credit for it, if he's still on the call. He's gone. Right, agenda item number 7 then, medium-term financial strategy, pages 17 to 44.
Yes, thanks, Chair. The purpose of the report is to consult Scrutiny on the draft budget that was approved by Cabinet in December. So the focus of this meeting will be the items relating to adults and health and wellbeing, which mainly fall in Appendices D and E. As Matt mentioned, this year has been pretty difficult trying to set a budget against the background of unprecedented uncertainty caused by COVID-19. The financial position keeps changing, and these changes will be reflected in the version of the report that goes to Cabinet in February and then on to Council in March. The main changes to highlight is that the COVID response funding continues to rise. We've had another £5.1 million of the contained outbreak management funding over and above the sum that's already reported in Appendix A. Since this report was prepared, we have had the local government provisional finance settlement, and that is better than expected. So next year's resources are now expected to be £263 million rather than the £259 million that are in paragraph 31. However, on the other side of the coin, we have been reassessing the ongoing spending pressures in adult social care and children's services, so there will be an update to figures in the February Cabinet report. Overall, it's a really mixed position. COVID continues to be a human tragedy, and in the short term, we have received significant funding to support our response, and our reserves are better than what we expected them to be, although they are still low compared to the average. In the longer term, we are still a low taxing, low spending council, and we still show deficits in each year, and that needs to be addressed so that we can be fully financially sustainable. I'm happy to take any questions on the overall position, and there's officers on the call to answer any specific queries. Thank you, Chair.
Thank you, Rachel. Any questions from any members, please? Councillor Steve Waltho.
Yes, thank you, Chair, and I guess Matt will want to comment on this because he referred to this in the previous item. on page 38, adult social care, and this was the follow-on from my question before, maintaining investment in the voluntary sector, given vital contribution made to the borough through COVID-19. I know I can't ask for a breakdown where this goes, and Matt has explained that very well. But I just wondered, has this increased from last year, or are we just simply kind of passporting government money through, which we must do, to kind of support the voluntary sector? I can see it's not put in there to increase in the next 3 years. No, I can't remember what it was last year. It increased from last year.
Matt?
Yeah, of course. So, if you recall from the medium-term financial strategy last year, the 160,000 that was referred to in this report had been put in as a reduction in spend for the voluntary sector. Following the feedback from this committee last session, when we discussed the impact that COVID has had on funding, particularly for the voluntary sector, I made the recommendation to Cabinet that we reverse that decision and we do not decrease that investment envelope. So the figure referred to in this report effectively cancels what was written in the medium-term financial strategy. So the good news is there's no reduction in the resource envelope. The bad news is that, as you can see with the range of savings that need to be found, there isn't an earmarked fund to increase that investment. My take on that is standstill is the best that we can afford at this particular juncture, and I'll come on to explain why as I answer other questions about the pressures and the savings.
Okay, thanks.
Thank you, Matt. Okay, Steve. Councillor Alan Hopper.
Thank you, Chair. My question is for on page 42, the children's services. I'd just like to know, we've got managed step down from external residential placements. Why there's a big increase in that, almost double? Well, it is double for 22 and 23, as opposed to 21 and 22.
I think that's probably one for the Children's Scrutiny Committee.
Yeah.
Okay.
Yeah. Sorry, Alan, it is, yes. We have to concentrate on the stuff in agreement with all the chairs of scrutiny committees and Cabinet on the stuff that relates to adult and social care.
Okay, no problem. Thank you.
Okay, thank you very much. Councillor Cathy Baton.
Thanks, Chair. So if we move on to Appendix E on the proposed savings, I have to say that I'm extremely concerned about some of the proposals in terms of budgetary savings. The position that we're in, whereby adult social care has, if ever we've needed a well-funded service, it is now. And to be thinking about streamlining and cutting budgets to absolutely essential services in the middle of a pandemic seems to me to be the height of irresponsibility. And whilst I appreciate savings because of the budgetary position we're in need to be made, is this the year to be making it? You know, we know that COVID absolutely affects the most vulnerable in our communities, and some of the proposed savings will affect the most vulnerable in our communities, in effect giving that double whammy. So that really, that's my contribution. I'm not expecting, you know, sort of an answer on it really. It's not necessarily a question, but it's more an observation that should we be making these savings at this, should we be proposing to make these savings at this point in time?
Thank you. Matt, I'll keep you at the background for a minute. I'll ask one or two questions first. Neil, did you want to come in? Neil Buxton.
Yes, please, if I may, Chair.
Yes.
I just wanted to make one specific point on an item that's included in Appendix C, and that's in relation to the Live Community project. This is something that colleagues in the CCG have worked quite closely with over the past few years, particularly in terms of the development of our integrated care model and the work that's been done in association with that project by the integrated care team that we've got in the Lye locality. And I know colleagues can point to a number of success stories there in terms of how they've worked together across both health and social care and the voluntary sector to support people who have been quite vulnerable and who who they've provided support, worked across organisational boundaries and had quite a positive effect. And I think whilst I fully recognise the difficulties that council colleagues face, and I don't envy the judgments that you have to make in terms of trying to set a budget at such a challenging time, I think certainly from the perspective of health, that would be something that we'd have some concerns about if that saving was to continue to feature in the budget, particularly in an area that does have quite significant health inequalities, many of which have been exposed even further as a result of COVID and so on. So just on behalf of my colleagues, particularly in primary care and in those who are working in the integrated care teams in that part of the borough, I just wanted to to make some representation in terms of whether it might be possible to reinstate that particular item. Thank you, Chair.
Thank you. Matt, did you want to come back on Kathy and Neil's comments?
Yeah, thank you, Chair. Well, if I can come back to Councillor Baton's points first of all. This committee, every year we have the same conversation about the much desired and never realised adult social care green paper, and fundamentally, until such point that we've got cross-party consensus at a national level about how the system gets funded in line with demand on a recurrent basis year to year, we are going to be in this hand-to-mouth position where the Treasurer has no choice but to ask me to pick up every stone and look for every possible saving. The growth that we've got in the budget is about the changing needs of the population and people we're legally obligated to serve. The inflation that's in the budget is the absolute minimum that we can get away with in order to keep the care market afloat, and I'm hoping that there will be some good news in February that will give us a little bit more investment to play with to support those organisations. I am very, very proud of everything that the service has achieved for the people of this borough over the last 10-11 months, and we can't keep year on year reducing the funding that's available to provide a vital service. Something has to give here. And those answers need to be reached at a national level in order to give us the tools that we need to do the job at a local level. So I do understand the question and I share some of those frustrations. The other point I'd like to make is there is too much of the adult social care budget that it comes in the form of grant funding that is renewed on a wing and a prayer, often at the 11th hour, often well into the new financial year, such as the Better Care Fund, such as the Independent Living Fund, such as the Disabled Facilities Grant allocation. That year-to-year hand-to-mouth existence makes it very difficult to plan and sustainably use those resources and leads to decisions that we otherwise wouldn't want to make. So it would be helpful if government could cease grants in those forms and give us at least a 3 to 5 year window to plan on. I would like to give assurance to this committee that wherever possible, I will seek to minimise the redundancies that are identified in this paper, and we will of course look to vacant posts within the relevant job groups to protect people's jobs as far as we possibly can do. The final point I wanted to raise in response to Councillor Baton is it is worth noting that we are assuming there's around about £800,000 worth of inflation on the Better Care Fund that comes in this year. Neil and I have discussed this point. At this juncture, he doesn't know what his budget is and he can't guarantee that that is the case. and that is a risk going forwards that everybody needs to be sighted on. So I think my team has done an exceptional job in modelling a significant number of savings whilst trying to minimise as much harm as possible. In terms of the specific points that Neil made about the Lie Community Project, I'd like to bring Marie Spittle in, who's the head of service, who's got more details about how that is proposed to work going forwards.
Thank you, Matt. Marie?
Evening, Chair. It was just to provide some reassurance that with regard to the savings that we've modelled with regard to Lie, we've had some staff out the business now for over 18 months. And when we looked at it in more detail, we found that there was some duplication. We've got obviously community development workers within health and wellbeing that have an active presence in Lie. So staff that were out the business, their roles had been took over by health and wellbeing, and the savings were put forward to avoid that duplication. We don't see any reduction in the senior social workers or the assistant social workers that actively get involved, as you said, Neil, in terms of the multidisciplinary ways in which we're working with the community, with the faith organisations, with individuals and other communities as well as Lie. But we also see it as an opportunity because Lie is part of the wider Lie and Access social work team. So we want to be able to, for the Access social work team to actually be upskilled as well, so we can offer more to the communities. So that was just the key points. Some staff have been out the business for 18 months. We've not replaced them. There is some duplication in the system, and also there's an opportunity where we can upskill senior social workers within Access to actually also develop the skills and that engagement and connection as do Lie.
Thank you. Councillor Jackie Carroll next, please.
Thanks, Chair. Yeah, there's a couple of items on Appendix E that particularly concern myself. One is the contracting out aspects of money management. That worries me a little bit because you're potentially not having as much control over the situation, and of course that will impact particularly on some of the most vulnerable and the least financially able. And the other one that worries me, perhaps particularly at the moment, is the 50% reduction in the budget for hospital avoidance, because I would have thought if we ever needed to avoid hospital at the moment, then it's probably now. So I'm wondering whether that, although I understand the reasons behind it, whether that might be a little bit of a false economy. Thanks, Chair.
Thank you, Jackie. Matt, do you want to come on that, and then I'll ask Kathy to come in next?
Yes, of course. So just to come in on the hospital avoidance beds first, we will still have the same level of capacity available in terms of respite care to stop hospital admissions. What we've seen as a consequence of COVID is a significant overall decrease in the number of people accessing residential and nursing care, and that ultimately has affected the budget. So you're quite right, Councillor Cowell, it should be a prevention first emphasis, and I don't think that these changes will decrease the number of people we're able to support pre-hospital admission at all. In terms of the money management service, it's important that the committee understands what that team do. So we've got a team of people who effectively manage, under the jurisdiction of the Court of Protection, the finances for people who do not have the ability to do so themselves and or no next of kin. The council will continue to run that service. The contracting out element we're referring to here are for those low volume, highly complex cases, often that involve complex probate, complex chasing up of records, trace contacting relatives, where we feel that a panel of appropriately approved solicitors will deliver just the same service at the same price to the estate, leaving the team to focus on the core business that we've got, which is people who need support to manage their financial affairs whilst they're alive. So that's what that saving represents. I think it's a much smarter use of the time, expertise and resource of the team. And just to provide some assurance, where we've got people with very complex needs, with communication difficulties, who are in an exploitative situation where they're at risk of being financially abused, we would, of course, continue to both safeguard and then manage the financial affairs of those folk.
Thank you, Matt. Kathy Baton.
Thanks, Matt.
Chair, I've just put it in the chat bar, and it was just really an additional recommendation that you write on behalf of the committee to government around the green paper. We have done that at least twice before, but I think it obviously needs doing again, and also about the impact of the year-to-year funding pots, the instability that this creates for all councils to plan and manage their services. So if we could have an agreement on that being a recommendation from this meeting, please.
Thank you, Kathy. Can I ask all members to look at the chat function and see if there's an agreement that first of all we note the contents of the proposed savings with some concern, obviously because of the year-on-year reduction of in excess of £3 million. It does eventually lead us to the point where, as Matt quite rightly says, we're depending on handouts annually as opposed to a static budget annually. You wouldn't run a business like that. And also about the request to get the green paper published, which I know Kathy and Nick have done on 2 occasions in the past. So if I can ask members to look at the chat function and let me know their thoughts, please. Any thoughts on that?
I think that's a perfectly reasonable thing to do again, Chair. Third time lucky, maybe.
Yeah. Chris, as Vice Chair, would you have a comment on that?
Yeah, I think this is a good idea to take this forward and to put it forward again. We'll see where we go from there.
Sounds reasonable, I think. So
I believe so, yeah.
Yeah, right. Are there any more questions on the financial outturn report? Kathy?
Yeah, I think, Chair, I mean, this committee, has historically made little comments really, or made no recommendations other than to note it. But I have to say, I would be really concerned about this committee noting and by effect agreeing to the cuts to these budgets.
Yeah, I think you're absolutely right. I think what we need to do, there is just one recommendation at the moment, that the committee considers and comments on the Cabinet's proposal for the medium-term financial strategy up to 23-24, taking into account the considerations set out in paragraph 38. What I would like to add there, if the committee is a mind to agree to it, is 2 additional recommendations. One is along the lines that Matt outlined about the long-term viability of adult social care, given the £3 million plus cuts every single year, and the fact that we get grants as opposed to a regular funding on a contractual basis. So there's that aspect of it. The exact wording of which we'll have to share with you, because what we don't want to do is to step on toes when we don't want to step on toes. We want to support and get us the best deal as we can. And the other one, of course, is the one about the green paper. If anyone's got any wording that they want me to put in, I'm happy to take that. Or if anyone has any suggestions, I'm happy to take that. Anybody? I've just written, while I've been talking, I've just written wording for one. The Scrutiny Committee notes the MTFS but expresses concerns about the amount of proposed savings over the next 3 years in adult services. Given we are in the midst of the most of the worst medical emergency in our national history. That's the one. And the recommendation about the Green Paper, this Select Committee calls upon the government to produce and publish the Green Paper on adult social care without delay. But of course, that we'll have to elaborate on that. Rachel.
Yes, thanks, Chair. It was not a comment on your actual wording there, but just to let you know that all the budget scrutiny will get together at the Overview and Scrutiny Management Board in a fortnight's time. Yeah. So there'll be another opportunity there to raise this and any concerns that you've got, and to make sure that everything is noted correctly. That's all I wanted to say. Yeah, well, I'm on the committee anyway, so I can raise I'll raise that. Right. Are members in agreement that we put those two additional recommendations forward? We'll smarten the wording up and let you know what they are. But is the consensus that we don't just sign off the documentation, but we make some comment on it?
Yes, Chair, fully agree with
yes,
what you've just said there.
Yeah, absolutely.
With all?
Yeah, absolutely. Yep.
Yes, Dave, I think we need to know what we're dealing with, don't we? What amount we actually have to start with.
Yeah, okay. All right. Well, I'll work on some wording with the officers, and I'll get that out to you ASAP. All right. Thank you very much. And thank you, Rachel. So we got the three recommendations, and one is the standard recommendation that's already there. The second one will be about expressing our concern about the cuts, and the third one will be about the Green Paper. Wording to be defined. Is that okay then? Yep. Thank you very much, everybody. That finishes agenda item 7. Moving on to agenda item 10, Health and Wellbeing Strategy, the annual review, pages 98 to 107.
Okay.
Hello, Karen.
Hi, Chair. Thank you. I'm just going to, obviously you've had the report. I'm not going to sort of go through the entire report, but what I'd like to do is just highlight one or two sort of key points within the document. I think just a reminder that the report updates on the implementation of the health and wellbeing strategy over the last sort of 12 to 18 months. And the report does show considerable progress despite the challenge that we've had this year, which has seen obviously resources diverted to leading and responding to COVID. I think also, if I could just remind that the current health and wellbeing strategy is running from 2017 to 2022, and has the sort of the 3 key goals, which are around healthy weight, reducing the impact of poverty, and reducing our loneliness and isolation, and also sets a number of principles, one of which is the key one about taking asset-based approaches and developing resilient and strong communities, which fits with the Borough Vision and the Forging the Future board. Also, as well as the 3 goals, there has been other elements of work that have been ongoing within the Health and Wellbeing Board and its work. One of which is that a COVID impact assessment is being conducted, which will inform the strategy, a sort of a refresh as going forward as required as a result of COVID, and also to any new strategy that's developed from 2022. Also, as following on from COVID, a specific subgroup has been set up that's led really with the community and voluntary sector. It's not a sort of just a statutory body board group, which has been being set up to look specifically around some of the short, medium and longer term impacts that COVID is having on the BAME community. So I suppose that's really an example of how the work of the Health and Wellbeing Board really is adapting as we go forward. I think one of the sort of areas of work that I'd like to highlight has been the development with partners and communities, the violence prevention strategy or plan for the borough, and that's now being taken forward and developed into an action plan. I think within the healthy weight element of the work, I'd like to highlight that true to form, we a community-led approach was taken to develop that work with a deliberative inquiry approach being taken, and that's identified 10 themes and sort of action plans within those themes to be taken forward. That was that was sort of put in place just prior to COVID really sort of having an impact on resources, and so although we've kept in touch really with those sort of community action groups, the full implementation of those actions hasn't yet been completed. In terms of poverty, prior to lockdown, the first lockdown in March, much work was conducted in terms of starting to look at the system and where the system could be improved, particularly in terms of trying to reduce some of the gaps and where sort of people were falling through the gaps in the system. And also there was some work done with communities looking at sort of understanding the impact of poverty on people's lives, with a particular view to work around the stigma and stereotyping that goes with poverty, because that was one of the sort of the key things that was coming out of the work, the assessment that was being done, and that resulted in a video which is the attachment is in the report. And hopefully at some point that will be properly sort of disseminated within communities and sort of showcased. But at the moment, the sort of the speed of work there has been paused, and work is now really more focused on the crisis element of poverty as a result of the COVID. In terms of loneliness and isolation, a number of, if I can just highlight that a number of community projects have continued to be supported. So we're very much taking a sort of a community-led approach really in terms of putting in place support around loneliness and isolation, rather than it being the council itself setting up services around that. Also, the Dudley Community Information Directory has been launched, which again is a sort of a directory of community support and assets as well as services that is available to all. And insight work continues, and the network events across the borough, working with our colleagues in social care, continue being delivered online. Okay, so there's more detail obviously in all of those areas in the report, and the recommendations are for the committee to note the progress, to continue to support and advocate for the goals within the health and wellbeing strategy, and to continue to work with us in a way that develops strong and resilient communities within Dudley.
Okay, thank you, Karen. Any member? Councillor Cathy Baton.
Thanks, Chair. Thanks, Karen, for the update. I don't think any of us would disagree with the three priorities being correct. COVID has absolutely highlighted that those are three really critical areas. However, I have to say I'm really disappointed that we don't have a report that reflects where we are now. So earlier in the meeting, I've suggested that when we were talking on the action tracker around the skills, and skills, linking skills to lifting people out of poverty is absolutely critical. Now, the last figures I've got for Dudley go back to October of last year. And we know that Dudley's claimant increase for age 16 plus was up by 73% from the previous year. That's going to grow and grow and grow. The claimant count for the Black Country was up to 65,980. And to be honest, I don't think our strategy is wide enough, deep enough, or responds quickly enough to the crisis that we're in. The deliberative inquiry work that has been undertaken, the community engagement has been fantastic up to date, but actually we now need to move it on at pace and in a slightly different way, I believe. We don't seem to have a completely cohesive, joined up anti-poverty strategy for this borough. And we know that, I think the Office for National Statistics suggests that the numbers of claimants will peak in the second quarter of 2021. So those numbers are going to go up. And I really think that this strategy needs to be represented in the light of the position that we're in. Thanks, Chair.
Thank you, Cathy. Karen, did you want to come back? Or Karen Wright, did you want to come in first?
Yeah, certainly. No, I think you made that. Yeah, I think you do made some valid points, which I'm sure that Karen would agree with. So I think, and obviously I'm on my third week here now, and I think that the Health and Wellbeing Board and the Health and Wellbeing Strategy in Dudley is in a very similar place to many other areas, and I think we're probably in the same place of saying, okay, so what do we do next? What does living with COVID look like? How do we at a granular level understand what the impact of it is? And you've highlighted some points about the benefits claimants. So I think Karen's already kind of kicked off some of this work within the team to actually really understand what is the impact of COVID in terms of inequalities. I think we've been mindful of that, just what I've seen of Dudley already in terms of some of the proactive work that's been going on. But then the shaping of the strategy moving forward, and we'll actually be considering those wider points that you're raising. And there are obviously some tremendous opportunities around regeneration in the borough that just present the opportunities for young people and across the borough. So I think the points you're making are valid, and I'm sure that those are recognised by the Health and Wellbeing Board, and they've already started thinking how to take those forward. And I think just on behalf of the public health team, who are or the Health and Wellbeing Directorate, and many other parts of the council who are currently they are flat out in actually response mode at the moment. So not forgetting that we need to do this. But it is recognised, and I think it will move at pace. But I think they are also, extremely focused on that kind of having to deal with response at the moment in that health protection mode.
Yeah, and I absolutely appreciate that, Karen. However, the fact is, as you've said, we're not going to be living with COVID forever. But what we will be doing is living with the impact of COVID for a considerable time. So in terms of the impact on our poverty levels, the impact on our unemployment levels, the impact on educational levels, we will be living with that for a significant time. So actually, in terms of business critical work, I would suggest this is business critical work to be done.
Yeah, if I may come back on that, Chair. So when I said when I meant living with COVID, I think that the immediacy of being kind of dealing with outbreaks and those things, but actually living with COVID and the other work is starting to happen, and has been looked at and has been going on, I think, in the background. To me, living with COVID is saying for the next year and potentially longer, we are living with COVID, and that's about actually understanding the long-term impacts on both from the first 1,001 days of life and before that, right through to to loneliness in older people and the impacts on jobs and mental well-being, as we've heard of. So I think I totally agree with what you're saying, that we do need to be doing this now. And living with COVID is not, it is the emergency response, but it's actually in the summer, kids in school and all those other things that we need to be planning for. And as directors of public health in the region, we're trying to get our heads around about, how do we do this best, working obviously with our partners.
And I would suggest that if people haven't linked it to the updated Barrow-Cadbury report that's been refreshed in 2020, it might be worth looking at that because of the backdrop that sets of where we were as a borough and where we were as a black country prior to COVID, and then where we are now. So I think that's a really useful piece of research.
Thank you both. Councillor Alan Hopwood.
Yeah, thank you, Chair. My question's on about the BAME community. In all communities, there's false information regarding the vaccine, and it causes mistrust. How are you going to approach this in the BAME community, and what plans do you have for that?
Thank you, Alan. Karen, did you want to come back on? Well, which Karen?
Should I take that one? You chip in.
Yes, I think that there is some work going on, isn't there, which you're probably more up to date with on the vaccination side of things.
Yeah. So NHS are leading on the delivery of the vaccination programme, but absolutely. So there's some really detailed work that's going on between the NHS and local government to actually understand what the uptake is. So where we have got vaccine hesitancy, which means people are reluctant to take up the vaccine, so we can understand really which are the groups that aren't taking that up. But we're also doing work with our faith leaders and other community leaders through the community champions. There's been some different social media that are being used to actually reinforce about the safety of the vaccine and address those concerns that have been coming through from different members of the BAME community and other sections of communities. And we're also doing some work with recordings for different community leaders, again, to be addressing those concerns and reinforcing messages. As we get some of the detailed analysis of exactly what that looks like in Dudley, then we'll do even more focused pieces of work through a whole range of different media, dependent on what's coming through. But certainly I know that work that's been done in other areas, the positive social media that's out there is really doing a good job and working across the whole of our communities in terms of allaying some of those fears. Thank you.
And just to add to that the communities themselves have also through the networks, through the community leader, the BAME community leaders out there, for instance, through places of worship, they're also doing that and sort of working to sort of change the misconceptions out there around not just the vaccine but other issues that are coming up as well.
Okay, thanks very much. That was very good. Thank you, Karen, both of you. Thank you.
Are there any more questions or queries about agenda items? No? Can we agree the three recommendations put forward by the report? I'm not going to go through them now. There are 2 bullet points in point 2 on page 98. Is that agreed?
Yes, Chair.
Lovely, thank you. Right, can I just go back then, if members will bear with me, can I just go back to the previous agenda item and read some wording out to you as suggestions for 2 recommendations. And what I will do, I'll get these to you. Recommendation 1, that the COVID-19 pandemic has highlighted the integral contribution of adult social care to protecting lives and delivering the critical care to the most vulnerable residents of the borough. The Health and Adult Social Care Scrutiny Committee notes the sustained failure of government to produce an adult social care green paper and provide a sustainable and safe footing upon which to deliver future care. The committee asked for a cross-party representation to government to prioritise adult social care as we emerge from the pandemic, cease short-termism and hand-to-mouth funding as an urgent priority. Second recommendation, the committee is also concerned about the adult social care in Dudley delivering significant budget savings whilst the pandemic continues to devastate the community, and asks the council to reconsider this. Is there anyone with any objections to that as it stands at the moment? I will get it out to you in written form if you can let me have your responses hopefully by the end of play. Is that okay, everyone?
Yep, sounds good. Yeah.
Okay, I'll get that email.
I think both points are valid, Chair.
Sorry, Chris.
I think both points are very valid, and you've spoken for the committee.
I think we've got to make our voice heard. We're a delegated committee. We've got a voice, and we need to use that voice and not just tick things off like has happened in the past. So,
I agree, Chair. Yeah.
Thanks very much for that. I mean, there might be one or two feathers ruffled, but we've done that for the last 2 years. It doesn't really make any difference, does it? All right. Thank you very much. That's agreed. Agenda item 11 now then.
Chair, sorry, can I just interrupt you, Chair? Are you going to email that recommendation out?
I'm going to do that to you, and you can email it out.
Yeah, perfect. Thank you.
All right.
Thanks.
I'm going to do that now, Helen, while this next thing's on. Developing the Dudley Telecare Service through development of a digital strategy, pages 108 to 112.
Thank you, Chair. I'm joined by the call centre manager for Telecare, Nicola Baum-Hammond. So the report's been circulated, but we thought we'd just take you through a brief presentation and then open it out for questions at the end.
Thank you, that's fine.
Helen, are you okay to share, or do you want Nikki to?
Is this what Matt has emailed me?
Yeah.
Bear with me a second. Yep, I can share it. That's
Thank
fine.
you.
Just bear with me just a second. Can you all see that?
Yeah. If you can just put the slideshow on, we can just go through them briefly. Can you take us through, Nick?
Yeah, no problems. I could go to the first slide, is that okay?
Yeah, it's up there.
Oh, can I move this along now, or just... That's lovely. So the first part of the strategy then was just to share our vision, and the vision is to support people of all ages and abilities to remain living independently at home. Digital technology should be a key feature, we believe, of adult social care, taking every opportunity that digital brings to extend our telecare offer by being part of an individual support plan and how care is delivered. We have already been and continue to reach out to service areas that traditionally underutilise tech and rely on traditional models of care. Technology will continue to provide a role in offering strength-based solutions. Could we go on to the next slide, please? So the strategy sets out Dudley's commitment to continue to build on the well-established telecare service, and I've been looking at development and growth of telecare, supporting the residents of Dudley ahead of the switchover, education of staff and stakeholders, rebranding the service, new initiatives being undertaken, performance and outcomes, and the challenges we face as we progress with our digital upgrade. We could have the next slide, please. The purpose is to support an ageing population, making the best use of resources and to avoid additional pressures on health and social care.
By planning the upgrade from analogue to digital, this will avoid approximately 9,000 people being left vulnerable across Dudley once the switchover happens. We will support adult social care staff through the development of a strength-based approach and ensure they consider technology to support individuals and carers to maximise independence and make the best use of the public purse. Have the next slide. With a population across the borough of a little under 321,000, Dudley has 64,683 people aged 65 and over. This has increased by 3.3% since 2008 and is forecast to increase by a further 4.4% by 2031. 25% of Dudley population is aged over 65 and 5% of these people are aged 65 years and over. With the local demographic picture in mind, and with telecare connections increasing annually, the need to ensure we are ready for the analogue to digital shift has never been more important. Between January 2019 and June 2020, we have seen an 8% increase in connections. Telecare services will need to remain switched on at all times throughout the upgrade, providing much needed reassurance and support to thousands of vulnerable client groups reliant on their telecare service. This slide just gives a brief overview of what telecare has achieved since March 2020. Telecare has taken 25,370 calls to assist sheltered housing schemes. They still managed to install 684 new alarms. They supported 292 non-injured fallers, have been supported to prevent an ambulance being called. And during the pandemic early days, some telecare staff were shielding themselves, and we were proactive and made the best use of what resources we had by contacting 2,492 vulnerable adults where we identified they had not used their alarms since March 2020. 199 no response call visits have been made to a property, and we've received 138,198 individual alarm calls into the call centre, with an additional 26,621 direct telephone calls. Take the next slide, please. Within the project, we have started to look at what challenges we face with the forthcoming digital switchover and how we can overcome them. And I've broken it down into what I believe are 5 key areas. The first of which is planning and awareness, where a project lead has been appointed and we've begun to obtain telephony upgrade plans from network providers. We need to confirm final protocols before we implement digital, and we need to put together a staff training programme so that our team can become digital experts. The second area is around connectivity, and we've been given assurance by providers that the new digital alarms have SIMs built in, and they've already had it confirmed that these SIMs will be roaming. Therefore, this provides a much needed robust backup system should individual network providers go down in the future. Meetings are now ongoing for the duration of the replacement programme with ICT networks to pursue viable options before any final procurement commitments are made. The third area is around standards and regulations, and this is mainly around the commitment we already have from network providers to complete further upgrades themselves across the area to reduce known areas of poor signalling and by switchover. The fourth area is around information security. As we know with new digital alarms, it is important that cyber protection and data storage is currently looked at and is being looked at by networks to determine the best and most secure pathway forward. We hope to roll out campaigns to educate residents and with the ongoing upgrades as each stage progresses. And finally, the final stage is around funding. An initial basic costing has been completed, and it's now to continue with ongoing planning meetings where we propose to complete replacements following a targeted phased approach across the borough, utilising existing funding from housing budget and revenues achieved from income for services, which will be phased over the next 5 years. Digital brings new initiatives and pilots, and telecare is committed to continually explore and pilot new technology-enabled care. Assistive technology packages are being delivered and developed to support carers and residential workers to deliver care that is less intrusive, providing independence to the individual, reassurance to the carers, and to aid the delivery of quality care. Our most recent investment in tech include Brain in Hand, Just Checking and Rita, all of which specialise in supporting adults and carers across many different settings. Brain in Hand is an on-demand support system that gives people access to a detailed personalised support plan from their smartphone, which is linked in well with their partners in Dudley Disability Service and Mental Health. Just Checking is a short-term lifestyle monitoring system where telecare take referrals to install Just Checking, which can then monitor patterns of behaviour and either identify the need for a package of care or a minor adaptation to their home. Advancements now enable us to see whether they are actually making food, taking a shower, and how they move freely around their homes to ensure they are getting the correct equipment or care to keep them living independently in their homes, safely, as opposed to alternative residential care. And finally, Rita is reminiscence therapy and is an effective and enjoyable way of connecting with someone who has dementia, helping to manage some of the more distressing symptoms of the illness by helping people to engage, feel less isolated and be part of group therapy. Utilisation of this type of therapy has also seen a reduction in falls in residential settings and a reduction in hospital admissions, enabling carers to manage individuals more effectively. Can I have the next slide, please? Alongside the upgrades, we also feel it's the right time to try and rebrand Telecare to ensure the brand is future-proof. After much consideration, we realised we wanted to keep the trusted brand name of Dudley Telecare Service, which is fondly known by many across the borough, and instead update the strapline and logo to deliver an independence through technology, where I am also currently working with CAPA to develop a new logo template for communication, hopefully from April 2021. We hope this will then ensure the vision and brand is effective to promote the digital offer both now and in the future. And finally, Telecare's commitment to continuous improvement. COVID has brought many changes to Telecare, and the team have already begun their transition to a new way of working. Workshops have commenced targeting teams where technology is currently underutilised to change both team and staff culture. Digital will mean remote programming will be possible, meaning an alarm can be installed remotely from a laptop once equipment has been safely delivered to a person's home. Digital alarms also transmit a heartbeat to the monitoring centre, which will allow a more efficient approach to early detection of equipment faults and failures, allowing these to be picked up quickly. More the team will be able to work remotely, meaning more installations can be supported, which will continue to support our new way of working, of which we've already adapted to throughout the pandemic. Hospital discharge packages will be more easily accessible as no phone lines will be required with the new digital alarm. An ongoing training will be delivered to prepare for the digital journey, where we can also educate partners to ensure all aspects of digital are realised. And finally, social media platforms are being explored to help with the education across the borough about our digital journey, as well as to provide key information about the forthcoming digital changes and what the Telecare offer is both now and in the future. Thank you.
Thank you very much. Thank you, ladies. Thanks for the presentation. Are there any questions from any members of the committee? You had to wait all night. Oh, yes, who's that? Councillor Cathy Baden.
Yeah, I wouldn't like to let you down by not having the last word after you told me I talked too much earlier. Yeah, thank you for the presentation, and I think it's heartening and really important that the council are looking at innovative and new ways of engaging with people with new technology, and particularly around an age group that is probably being generally quite resistant to it. So I think those novel and innovative ways are critical, and maybe as we move forward, those kinds of new technologies will make quite a difference around sort of the issues of isolation and the ability to communicate. So thank you for that.
I think we've seen that, Councillor Bainton, in the fact of some of our groups. I think Councillor Walthour mentioned earlier about Queen's Cross, and a lot of our groups have gone digital using the Zoom, and we're also working with Just Straight Talk in terms of digital buddies, so you know, supporting people to develop their skills to become engaged and connect to others. So using COVID as a positive onwards and upwards in terms of that connectivity.
Thank you, Marie. Matt, do you want to come in?
Yes, thank you. I mean, this is a bit of a jewel in the crown for us, this particular service. So 9,000 people in the borough now connected in some form is quite a significant chunk of population. The service runs 24/7 and has a responder element to it where necessary. And you saw in those key stats, not only are they a lifeline in terms of getting to people who otherwise wouldn't get the response they need when they need it, but think about the impact they've had on the ambulance service, on admissions to hospital, on enabling people to live in their own homes for longer when otherwise they might have had to go to residential and nursing care. And the service has had some huge challenges throughout the pandemic. At one point, we had to outsource the entirety of telecare to Tunstall for a couple of weeks because there was a COVID outbreak, and they still kept the show on the road, and they still supported everybody who was connected to that service. So I think there's some really exciting opportunities in terms of what we can do next with digital. I think we got the right head of service with Marie. Nicola's done wonders since she's been managing the service as well. And I think we are going to be in a position that is significantly ahead of the vast majority of local authorities with the infrastructure we've got and the talent we've got within the service. So I just wanted to offer my thanks to all of them for everything that they've done in the last 11 months. And I think what they've shown is really genuinely exciting going forwards.
Thank you, Matt. And I think I'll come in and agree with that in a second. Karen, you keep disappearing out of sight. Karen, do you want to say something?
Yeah, I would actually, just to echo what Matt has just said. Then I've come from an area that's done a lot of work around digital, but I think in terms of enabling older people to maintain their independence and well-being moving forward, I think this is a really good thing that's come out of COVID, and it's a real catalyst for getting more and more people online and to be able to access these services. So I think tremendous, really good work, and we should be really proud of this, and just look forward to working with the guys taking that forward. Thank you.
Thank you, Karen. I think from our perspective as members of the committee, I mean, we know that people who've never been housebound are now frightened of being housebound with COVID. Imagine being housebound anyway, and COVID knocking on the door, and to have a friendly face and a friendly voice at the other end of the phone, it must be a real boon to them. I think you do a marvellous service, and all power to you. Although we've got the best staff, as Matt said, we've got the best staff running here. So thank you very much for the report, and we'll take the recommendation on to support you. All right. Thank you very much for the report.
Thank you.
Helen.
Yes, Chair.
Hello. I did send you an email. I don't know if you got it. With the recommendations on.
Yeah, I've got it.
All right. Hey, is there any chance you could send that out ASAP to the members of this committee? It's as I've read out, but you'd have to top and tail it to make it look official, because otherwise it'd be a bit scruffy otherwise. So if you can send that out as soon as you can, and we'll put those recommendations in our report for tonight. I'll convey those recommendations at the OSMB on February the 1st. We're not being nasty to anybody, but we really need to come up to the mark as a committee, and by putting those two recommendations forward, I think we've done our job tonight. So thank you very much for this evening, everyone. Agenda item 12, to consider any questions from members of the chair where 2 clear days notice have been given to the monitoring officer under Council Procedure Rule 11.8.
None received, Chair.
Lovely. Thank you, Ellen. Thank you, everybody, for turning up tonight. Thanks for a wonderful committee meeting. We're doing what we say on the tin, so long may it continue. I don't know if I'm going to be here in May, after May, September, or next year, but we'll soon see as soon as I make a decision about the election. So stay safe, everybody. All the best.
Yeah. Thank you, Chair. Thank you.
Yeah.
Thank you.
Thanks, Chair. Thanks,
Thank
everyone.
you, everyone. Thank you.
Good night.
Good night, everybody.
Good night, each.
Good night.